Urgent action is needed to reduce excessive wait times for medicines to be listed on the Pharmaceutical Benefits Scheme. That's according to one patient representative organisation. And this follows a warning from the peak industry body, Medicines Australia, that the delays are a much greater threat to the sector than the US president's far-reaching tariffs. Christine Cockburn is from Rare Cancers Australia and is with me in the studio. Thanks for coming in, Christine. So what difference to cost does it make to have a medicine listed on the PBS? Can you give us some examples?
Certainly. So if a medicine for a cancer is listed on the PBS, a patient will typically pay $31.60 on a script, which we all know. That will soon become $25 under the new reform, which is brilliant news. However, if that medicine is not on the PBS for a person's specific type of cancer, then they will have to pay the full cost out of their own pockets, not on the PBS at all. And that runs to tens of thousands of dollars. Many people that we know and support at Rare Cancers Australia are tens or even hundreds of $1,000s out of pocket paying for the same medicine that the person in the next chemotherapy chair is paying $31 for.
Are there medicines or treatments that are going through the process of being listed on the PBS right now? How long has that process been so far?
So what we've known for some time is that it's taken well over a year for medicines to go from the TGA registration, which is where they are known to be safe and effective, onto the PBS, which is where they cost $31. Now, we've thought that was about a year and a bit, and latest data tells us we're looking at almost 2 years of a delay.
So those patients who need the drugs that are in the process of being listed or are not on the PBS, how are they managing to pay for them?
It's pretty sad, Ros, to be honest with you. There are a lot of people that we look after who remortgage their homes. We know of a young woman recently that moved out of her own home, moved home with her mum, and she's in her late 30s. And we also know a lot of people turn to crowdfunding, which you probably can guess comes with a terrific loss of dignity, having to ask friends and family for money. And those people are looking for tens of thousands of dollars. It's difficult for them, it's difficult for their friends and families, and quite frankly, it's inequitable.
Why does it take so long for medicines to be listed?
It's a good question, partly because of the way that we understand the way cancers and medicines work now is not keeping step with the way that we assess them to go onto the PBS. So we know now that a medicine could work across many different types of cancers because of a signal or an indication inside the tumour, but we're still bringing them onto the PBS one at a time, one cancer at a time, one medicine at a time, which means there's a great long queue of people waiting for medicines that could be effective for their cancers, and they may never come to the PBS, and people are dying waiting.
And the time it takes to list medications on the PBS is a long-held complaint of US pharmaceutical companies. The government says the PBS won't be part of any trade negotiations with the threat of Donald Trump imposing tariffs on the industry. Do you agree that the PBS shouldn't be part of any bargaining with the US despite the delays in listing?
Look, absolutely, despite the delays. I think we have to get our own affairs in order locally. We've got a review of the way that we value and bring medicines to Australia at the moment. Unfortunately, that review was commissioned 2 years ago. The findings came out, the recommendations came out 1 year ago, and we're still waiting for a plan. Now, we know the Minister has impetus to get these medicines and reform up and going, but we've waited far too long.